So what is an FP1 and what does it stand for? So FP stands for fixed prosthesis. And what everybody understands out there is the all-on-4. But in the dental world, that was actually an FP3, fixed prosthesis 3. And they had to create fake gum. So that is what the fixed prosthesis 3 is. Now, what is an FP1? So fixed prosthesis 1 will be just the bridge. So no fake gums, just the bridge of teeth. So there's no fake pink at all in the prosthesis. So in between an FP1 and FP3, there's an FP2. So that's going to be a little bit longer teeth and have maybe a little bit of fake pink gum in between the teeth, but not on top. So it's just longer teeth with a little bit of fake gum. But FP1 is real neat because you can't tell that they're fake because it's coming right out of the gums. Whereas with an all-on-4, you lift your lip, you can see that transition line of the all-on-4. So the FP1 is really neat because where in the all-on-4, the FP3, we have to reduce bone to make space for all of the parts and pieces, the abutments and the screws and everything. We have to make space and we have to make that fake gum, but it works for a lot of patients. So a lot of patients are candidates for an all-on-4 FP3, but not necessarily a candidate for the FP1. Reason is, most patients lose their backbone first. So they lose their teeth in the back, their molars, and over time our sinuses end up dropping and we lose that ability to put an implant back there. So we have a little divot in the bone in the back, and so that's why the all-on-4 was a great option for them. We're able to angle implants towards the back and load up a prosthesis that gets us back to our molar. And so that's why all-on-4 became real popular. We got those angled abutments so we can angle our implants back and then bring those abutments straight so that we can then put the prosthesis on and get it all the way to the back. Now, a candidate for an FP1, they are able to come in, they are usually a younger patient, maybe they haven't lost any teeth yet, the teeth are just decayed, and the bone is in great shape. No periodontal disease, the bone level's pretty flat. We can do very little to no bone reduction on those patients. And when we do that, we just basically put the implants in and we're able to make a prosthesis that goes around, and we can then shape the gums to make it look very natural, like it's coming straight out of the gums. So if a patient has a high smile line and shows a lot of gum tissue when they smile, an all-on-4 can be difficult because we have to sacrifice certain things in the prosthesis, like cleansability. We might have to have a little flap so that we can hide that transition line, or maybe they show that transition line. But with the FP1, it's really great for patients that have that high smile line where we can now hide that. We're able to make it look like it's coming right out of the gum and make the teeth look really natural. But also during the procedure, we're able to raise that gum up a little bit, like this patient right here. They had a high smile line when they came in and saw us, and we saw a lot of gum tissue. But in the procedure, when we were doing the FP1, we were able to raise up that gum tissue, and there was a little bit of bone, but very minor. So a lot of times we're able to not reduce bone, but in some cases we'll reduce a little bit of bone and be able to bring that smile line a little bit higher.
We've now placed all the implants, and what we need to do with the FP1, we are just replacing teeth. And so in this particular case, we're going to be lengthening the crowns of the teeth from what the patient originally had. So in order to do that, we need to contour the bone around where the new teeth are going to be so that they seat properly. And that's what Dr. Rodriguez is doing right now, making a little flap and going to be doing just a little contouring of that buccal bone. But you can see how little, in this situation, how little bleeding we had to deal with compared to, like a traditional all-on-4 where we're making this big flap and reducing bone. So think of that in terms of healing.
So you still have to make a flap though to get the teeth out, right?
No, I didn't really know. I did
really?
it without making a flap. I mean, I made a little incision around the crowns of the teeth, but I didn't reflect anything. So we're reflecting that. So in this case, because we are doing some essentially crown lengthening or making the teeth a little bit longer for cosmetic purposes, he's having to do a little bit of contouring of that bone to accommodate for that.
So for the FP1, how many implants do we need to actually get the FP1 to work?
So Typically, we're going to need 6 to 8 implants for the FP1. The difference between the FP1 and the traditional all-on-4, the FP3, is the prosthesis in the FP3 is a lot thicker. So you can have a cantilever or a distal extension area that isn't supported by an implant. But in this case, because we're only replacing the tooth portion, the prosthesis has to be a little bit smaller and a little bit thinner. So we have to have more support, more foundation for that prosthesis, so we can't have a cantilever or we'll risk that fracturing. So in this case, we placed 8 implants, 4 on each side, going back to the first molar.
So when you typically do an all-on-4 procedure, how much bone reduction do you need to do on a patient?
Well, that varies from patient to patient based on their, their anatomy, their smile line, their, how much their lips move. So it's kind of an individual thing, but, in most cases we're reducing, 10 millimeters or more of bone. So.
And with the FP1, did you reduce any bone when you did the surgery?
No. We placed the implants, and the only bone removal we're doing is just some contouring. So we're talking a millimeter or 2. And that's just along the facial aspect for cosmetic reasons. It's not, all the way across.
And what makes a good candidate for an FP1?
Well, number one, you have to have, a good amount of bone present. So someone with significant periodontal disease is probably not a good candidate who's already lost a considerable amount of bone. So people who have good bone structure, but maybe their teeth are just really decayed, but the foundation is really good, that would probably be the ideal candidate.
So we have to plan for an FP1 case a lot more than we have to plan for an all-on-4. The all-on-4 gives us more room for movement when we do put the teeth on. There's a small hole that is created in the all-on-4 prosthesis so that when they go put the teeth on, we have some variability that we're able to adjust for. With the FP1, the bridge is a lot smaller than the all-on-4, so we don't have as much wiggle room to play with, so we want to be very precise.